Greetings of the season. I am Dr. Vijay Warad, allergist, clinical immunologist practicing in Pune. Last 34 years, we have seen like other fields of medicine like diabetes, cardiac problems, neurology. So many super specialization has developed. But the worldwide, more than 100 years, the allergy and clinical immunology practice is done. There are institutes, but in Indian scenario, even in the medical colleges also, there are no departments of that. And that's why the people like me, which have been practicing in this, we have been trained from outside and clinical practice. We are developing that strategies and the Indian College of Allergy, Asthma, Immunology, Indian Academy of Pediatrics Allergy Chapter, Indian Allergy Organization. They are doing a great work in spreading the knowledge of allergy clinical immunology in clinical practice. How we should manage the allergy patients. Allergy starts from even intrauterine sensitization happens. And the children with eczema, atopic dermatitis, or the repeated colics, GRD, they may overcome those symptoms, but many of them go into rhinoconjunctivitis, which has increased a lot now. A lot of children they go on rubbing the eyes, nose, or ears. Then later on, sinusitis, ear problems, otitis, throat tonsil adenoids, throat infections, lower respiratory infections, childhood asthma. Out of that, many children they overcome the childhood asthma, but underlying them, 90% have allergy. That continues with the newer sensitivity formation. The minimal persistent inflammation into the body continues, and later on, many of them have a deviated nasal septum, obstructive sleep apnea, or adult asthma, chronic respiratory disease. As the primary inflammation continues, then the indoor pollutants like toilet cleaner, floor cleaners, deodorants, perfumes, then outside the vehicular exhaust or construction dust, they add on the effect on this Th2 inflammation now it is called. And it continues and then leads to the severe asthma, severe chronic respiratory diseases. And if they are not managed properly, even 2014 the study was done, out of these asthmatics, whatever they failed, okay, they are controlled. But hardly 92% were not having a good control of asthma or inflammation, we can call it. So this continues. And if you see the ARI area guidelines or the 2023 GINA for asthma or gold for COPD also, the environmental trigger has to be identified. It has to be avoided. So that concept should be developed like a diabetes, how we manage the sugar, we ask the patient what type of precautions, what type of diet should be utilized. The same way here also. The environmental control, indoor, outdoor, what are the allergens, we can specifically diagnose with the standardized allergy testing. Most of the patient, the skin prick test is useful. Few of the patient, wherever there is a significant food allergy, then the blood immunocap specific IgE or component dissolved diagnosis with a multiplex assay method now, which is available in India. We can even diagnose the epitopes on the foods which are triggering the significant allergy symptoms in the patients. So that way, the patient should be educated about this environmental control so that whatever the medications like inhalers or nasal sprays we are giving, they act faster, the inflammation is controlled much better, and the further exacerbations and episodes of the allergy go down. And then the adherence of these treatments to the this research and scientific based treatment will be there. Otherwise, at present, the patient is just roaming from one doctor to another, from one pathy to homeopathic, Ayurvedic, or something. Symptomatically, maybe the patients are controlled by some or the other medications, or the further allergic march or atopic march, which is not controlled. And that's why these patients are going into further cascade of this allergy, leading to different parts involvement. Even the adolescents, adults with severe eczemas, we are seeing a lot of severe vernal keratoconjunctivitis requiring eye steroids, repeated eye steroids causing early cataract glaucoma and requiring early adolescents or adult surgeries for the cataract and glaucoma also. So these are all complications. Then obstructive sleep apnea, we all know how they are leading into strokes or blood pressure problems or cardiac complications. Severe asthma, which is not controlled, will have a severe cardiac problems. So this is all interconnected, and this inflammation into the airway, which will have a respiratory acidosis, and the oxygen supply will not be there. It has behavioral problems, neuropsychiatric complications leading to the systemic like obesity, cardiac problems also. Then allergy, asthma, immunology, autoimmune disorder, it's all connected. So we want to give a patients a better quality of life, a better control of the symptoms, further s- stopping the progress of the disease. And even 1998 WHO, World Health Organization, also has a position paper which itself mentions that then allergen avoidance and immunotherapy are the disease modifying therapy which can really stop the progress of the disease, newer sensitivities, and that awareness also should be brought into the community. So it requires a detailed history of the patients, environmental exposure, then selected standardized allergy testing, then simple precautions, and whichever cannot be avoided, then desensitization for the specific allergens like dust mites. They are corrodes in a bed, in the sofas, curtains, cushions, car cushions. Then funguses, they can be in the kitchen food particles which are in the deep pockets or in the office spaces like public bathrooms or bathrooms where there is a damp walls. Then pollens, they travel many kilometers. Even animal danders, they can travel around 14 to 15 kilometers on clothes or hairs or something. So those detailed history, clinical examination with the hidden signs of allergy like nostrils, the inferior turbinate hypertrophy, dark circles or wrinkles or Muller's muscle spasm, Denny Morgan folds. Then there is a derriere line on the nose because of the rubbing. There is a fold over there at the hard and soft part. Then cervical lymphadenopathy, posterior pharyngeal hyperplasia, long eyelashes, sinusitis after proper pressing, and we can identify that. Then migraine. Then again, many of these patients will have a overlapping of food intolerance and other allergies. So that has to be educated to the people. And then the target therapies like biologics in a severe cases where the repeated oral steroids or parental steroids are used. We can use these omalizumab, mepolizumab, benralizumab, now etikimab. So many target therapies are there, dupilumab, for the specific interleukins, even against the TSLP. And that awareness should be brought into the community.